A diagnosis of diabetes in your cat can sound scary at first, but with proper planning, managing your cat's health at home doesn't need to be difficult. I'm Dr. Aubrey Lavazo. Twin Cole, our technician, and I are going to show you a few of the basic steps when it comes to administering insulin to your cat. Keep all insulin refrigerated, use as prescribed, and handled carefully. We need to have ready a one-time use disposable needle and our bottle of insulin. Check with your veterinarian on whether their injection protocol includes sterilizing your cat's skin prior to injection. Before you give an injection, remember to keep your veterinarian's feeding instructions in mind before giving the shot. When you take your insulin from the refrigerator, gently roll the bottle in your hand to mix it. Don't shake. Invert the bottle, insert the needle, and pull back on your plunger until the prescribed amount of insulin is in your syringe. You can push back into the bottle until you're at the correct amount, and that eliminates any air bubbles. Pick up the loose skin between the shoulder blades to form a tent. When injecting, push the needle quickly and firmly through the skin. Practice on fruit or a stuffed animal to become more comfortable with giving the injection. It is important to manage food and caloric intake to keep the cat's glucose levels constant. Regular monitoring is essential. Your veterinarian will suggest a combination of clinic visits and home monitoring to keep a close eye on your cat's health. If more than one person in your household is involved in your cat's care, consider keeping a journal in a specific place so everyone knows if the cat has received his injection at the right time. Disposable syringes are meant to be used only once. If you miss an injection or wonder if your cat has received the full dose, skip that dose and wait for the next one. It is always better to underdose rather than risk overdosing. A diagnosis of diabetes is not a death sentence for your pet. Diabetes can be managed and your cat can live for many more years after a diagnosis.